Hey folks, it's Dr. Sparks here. Just wanted to give you a little information on thyroid, especially underactive thyroid. A lot of times your doctors will do a TSH, run a TSH lab. And as you can see by this whole chart that I've created, TSH is just one of the hormones involved in thyroid. TSH is the hormone that comes from the brain down to the thyroid to stimulate the thyroid to make thyroid hormone. And you need iodine and tyrosine to make thyroid hormone. And in the thyroid, it's mainly T4 that's made and a little bit of T3. T3 is our active hormone. And then T4 and T3 there can be bind to a protein here called thyroglobulin. And some of it is actually free, so it just isn't bound to this protein, and it goes out into the blood and is free to go into cells to be used. See here, free T4, free T3. But most of this T4 goes down into the liver and some other places in the body and gets converted into the active hormone T3. And you need these conversion factors for it to be able to happen. B6, B12, zinc, magnesium, selenium, and some other trace minerals. So then it becomes T3, and more of it is unbound than bound, and goes out into the blood and goes to the cells. And here's some cells, like this could be a pancreas cell, a skin cell, any cell. And it goes to the receptor site, binds, and then helps regulate metabolism in that cell. Then T4 also will go back to the brain and tell the brain, hey, we have enough, so you don't have to make too much TSH, or, oh, we don't have enough, so you need to make more. And that's why sometimes you'll see in your lab, this TSH will be high if you're actually low in this hormone, and it will be low if you're high in this hormone, because it's an inverse ratio. On my next one, I'll talk a little bit here about the stress response related. So the reason that I'm telling you this is because if you want to see what's going on with your thyroid and you have any sort of thyroid disease like Hashimoto's or any sort of underactive thyroid disease, you want to have this tested, the TSH, but I also like to test the free T4 and the free T3 because I want to see the whole picture, right? Because we could be making enough of this, but we might end up with just this and not enough of these. And it says, oh, well, it looks like we have a good amount. But if we're not converting to this active hormone over here, then you're actually not getting what your body needs, right? So a lot of times it can be deficiencies in these types of nutrients. So check back, and I'll talk a little bit about stress response.